I'm Dr. Suvarchalaa, Scientific Director with ZIVA Fertility Centers. Does the location of uterine fibroids have an effect on pregnancy outcomes? This is the topic for today. The location of uterine fibroids can definitely have varying effects on pregnancy outcomes, and the impact usually depends on the size, the number and the location of fibroids as well as individual factors. Fibroids are non-cancerous growth of uterine muscles that develop within or on the uterine wall. They can be categorized into different types based on their locations. Let's look at the most common types. Subserosal fibroids. These fibroids grow on the outer surface of the uterus and may protrude into the abdominal cavity. Subserosal fibroids typically have less impact on pregnancy because they do not distort the uterine cavity. Intramural fibroids. These fibroids develop within the muscular wall of the uterus and can potentially distort the uterine cavity if they become large. The impact on pregnancy depends on their size and location within the uterine wall. There are submucosal fibroids. These grow just beneath the inner lining of the uterus, which is the endometrium, and have the greatest potential to affect fertility and pregnancy. They can distort the uterine cavity and interfere with implantation and development of a pregnancy. The impact of fibroids on pregnancy outcomes can include infertility. Submucosal fibroids especially that distort the uterine cavity can interfere with implantation and fertility. They may need to be removed surgically, which is called as myomectomy, before attempting to conceive through procedures such as IVF. Fibroids can also cause miscarriage. Fibroids, particularly submucosal ones, have been associated with an increased risk of miscarriage, especially in the first trimester. The exact mechanism by which fibroids may lead to miscarriage are not fully understood, but may include reduced blood flow to the developing embryo or disturbances in the uterine lining. They can also cause preterm birth. Large fibroids or fibroids located near the cervix may lead to an increased risk of preterm birth. Fibroids can disrupt the normal architecture of the uterus and interfere with its ability to contract effectively during labor. Fibroids can also obstruct birth canal or interfere with baby's position, making it necessary for a cesarean section delivery in some cases. In rare cases, fibroids may increase the risk of placental abruption, with the placenta detaching itself prematurely from the uterine wall. Many women with fibroids have successful pregnancies and healthy babies, so do not get worried. The impact of fibroids on pregnancy outcomes varies widely from person to person, depending on the factors of the size, location and individual health. Monitoring and management by your fertility specialist is very crucial for women with fibroids to be able to conceive, or even for those who are already pregnant and they want to manage fibroids during pregnancy. Treatment options for fibroids during pregnancy are limited due to potential risk with surgery or interventions. However, if fibroids are causing significant complications or pain during pregnancy, medical management or surgery may be considered on a case-by-case basis. It's very important for women with fibroids to work closely with their fertility specialist or their gynecologist so that they can optimize their chance of a healthy pregnancy and delivery. If you wish to understand your chance of pregnancy with the fibroids that are present in your uterus, please feel free to contact us. Thank you. A lot of effort has gone into making this video. Please like and subscribe us. Thank you.